Colm Galligan from Merck. Thanks for coming down.
Thanks for having me, Marty.
Yeah, we're very welcome. And you've been meeting some of the teams today from all around the world. What were your initial impressions?
There's a great bunch of people in here.
Cool.
And they've got some very good ideas. And, you know, I was very kind of surprised by how far along a lot of their products actually are. Some really interesting kind of prototypes, some great kind of ideas, plugging a lot of holes.
That's cool.
So, yeah.
Quite a mixture as well, right? From
It's
mental health to fitness to nutrition.
Absolutely, yeah. And I think a lot of them have, you know, done quite a bit of the heavy thinking so far in terms of trying to carve out that gap in the market. So they appreciate, they have a good appreciation of what's going on there. Whereas sometimes you see people with really good ideas, but you know they haven't really put them in the context of the healthcare marketplace.
Right.
A good group there.
So you got a very unique set of experience. You've been an entrepreneur, you're a trained doctor, you work for a pharmaceutical. So you can see the different angles. When an entrepreneur comes to you or comes to Merck,
Yeah.
what gets you excited, or how do you think about,
Sure.
how do you look at that?
Yeah, I mean the healthcare marketplace is changing, especially from a drug company's point of view, not just Merck's, and you know we're all in the kind of same boat as in that you know we all have really fancy technology these days. We have some absolutely incredible drugs, but you know the problem is that the cost for developing these drugs has gone through the sky. We're finding increasingly now that you know we have some great technological products with some great data to back them up. The real challenge now is proposing the value, and that's what I've spent a lot of time with the guys today trying to say is, you know, put yourself in the payer's hands. Do you know what I mean? Rather than just coming to them with a really flash piece of technology that all looks really good on a kind of computer screen, try and put yourself in their shoes. Is that, you know, healthcare budgets are pretty much maxed out globally now, so the proposition has to be, I'm going to help you offset some of your costs. Or if I'm going to increase your costs, it's going to directly translate into, you know, improved durations of life, or, you know, increased quality of life in particular areas.
Okay.
And there's this whole emerging area of kind of health economics and health technology assessment and what they call market access. And they're the key issues at the moment. You know
Market access, what's it?
Market access is trying to get in. So for example, you know, if you want to bring a drug to market in Europe, well, you know, the government directly or indirectly pays in the vast majority of cases. So they're your single kind of payer.
Right.
So that's your access, is you know, not just proving that the drug is safe and effective, that your technology works in the benefit of patients, but that it's actually cost effective.
Right.
You know, and there's this whole area now trying to put in place economic modelling around quality of life, duration of life, etc., like that. So I'm trying to work with the guys to try and, shall we say, front load a bit of that thinking.
Yeah.
You know, so that by the time that their products are fully ready and they're going out to potential payers, whether it's a single centre, whether it's a health insurer, whether it's, you know, government institutions such as the NHS, that they've got those arguments, they've got that kind of evidence already in place.
And so I guess there's a lot of talk about outcomes. I mean, that seems to be something quite topical at the moment from an industry point of view, right? Is that the same thing as being able to demonstrate that it has a cost advantage and a quality of life advantage? And
that's what the outcome is. You know what I mean? Ultimately, what are we looking for health? We're looking to live longer, but at a much higher quality. Do you know what I mean? And that seems to be a value now. Like, I mean, and the payers in Ireland, the UK, and elsewhere put a value on that. In Ireland, for example, it's €45,000 per quality adjusted life year gained.
Okay.
So if you can prove this, then your drug automatically gets reimbursed.
Okay.
In the UK, it's around £20,000-30,000. You know what I mean? And there's some variations around this in certain scenarios. But that's what the model's moving to. As we have more and more technologies funneling into healthcare, there's a lot of choice of technologies you can actually use.
Right.
So, you know, how do you pretty much judge them against the same kind of bar? And it's through this kind of mechanism, health economic modelling, to produce this output called quality.
Colin, thanks very much.
No worries,
Much appreciated.
Pleasure. All right.
Cheers. Thank you.